Okay, welcome to the part 3 video of clinical orientation. You finally made it to clinical. Holy cow, now what? Well, when you first get there, you will have 2 orientations. The first is your clinical orientation form, and I've put in the upper corner right there where it can be found, and that's in Blackboard. This is the one that you complete on your first day of clinical. It will go over the different code systems, infection control, all that kind of new employee sort of stuff. This may be performed by the human resource department during your first day, or it may be performed in-house in the radiology department by your clinical instructor. Either way, it will depend on the site, but you will need to have it completed and uploaded into Blackboard on your first day. The next orientation you'll have is your equipment orientation. This needs to be completed before you use the equipment on a patient. It may be that not all these categories may apply to your facility's particular equipment. There may not be an area, for example, where you just set a manual technique in the fluoro equipment. But again, you will need to be oriented to the equipment so you know where everything is. It needs to be signed off and dated before you use the equipment. The one you're going to use most often is your competency evaluation. This is the one that you will fill out at the top part, and that gets completed for every imaging evaluation that you perform. Now, a couple of really important things. Up at the top where the little blue arrows are on either side are the sections that will need to be returned completely. And the most common reason that evaluations get turned back is because this top part wasn't complete. Every evaluation you perform needs to have 3 boxes checked. Whether the exam that you performed was mandatory or elective, whether it was performed on a patient or was simulated, whether that exam was performed on an adult or a pediatric patient. So you got name, the procedure is the name of the exam, like ankle or upper GI. And then 3 boxes. Those up at the top have to be checked. Very, very important. The next part, again, the numbers is what your clinical evaluator is rating you. Whether you did it perfectly, you're fantastic, you exceed all expectations, that would be a number 3 in each one of those skills category. Now, another thing to remember is the projections must match the exam. For example, if you had a pelvis, you would have most likely just 1 projection, which would be an AP. If you come out with pelvis and I've got 3 projections rated, then I need to know what the story is. Maybe at your site you did 3 projections, and that may be legit, but we got to make sure that matches. You'll need to tell me what they were, like AP. You can write it up at the top, AP. Maybe you did Judet views, so inlet and outlet views. I need to know that, because if it's not normal and it doesn't match, I'm going to bounce it back to you and make sure. The registry does allow for some simulations in the event that maybe it's an unusual exam. Those are used only as a last resort, and that should be like in your final week, the final couple of days, if you have something that just didn't come in for whatever reason. I don't want you to panic or flip out that you have to extend, but again, those are used only as a last resort. It's always best to have it performed on a patient when at all possible. So again, make sure you fill that out correctly. If I have to bounce it back to you, then you've just doubled both of our work for not filling it out correctly. So again, I have over 100 bits of paper for each and every single one of you. So can you imagine the workload that that entails? So again, do us both a favor. Do it right the first time. What you must not do, and if your clinical instructor does this, don't wait for me. You bounce it right back to them. They may not draw a number and an arrow all the way down. They have to score each individual skill with a number. Okay? I don't care what they do for other programs. Don't accept it and say, well, with all due respect for my program, they won't let us do that. You can make me the bad guy. I don't care. So it's like Miss Steele won't have that. You know, she's such a witch. So each one of these has to have a number. No arrows all the way down. So that is what not to do. All right. So your timesheet. Now this is one of your weekly sheets that you will have to turn in. So a couple of things. You must take at least 30 minutes for lunch every day. Period. If you don't put it on there, I will deduct it for you. Your meal break does not count toward your clinical time. You're not doing anything clinically related while you're eating your bowl of ramen noodles, right? So that does not count toward your clinical time. That information's in your clinical handbook as well. Also, you need to provide a total number of hours for each day that you've worked, subtracting out your lunch break. And then at the end of the week, give me your total hours worked per week. Make sure that your technologist signs it at the very bottom, under preceptor signature. You just sign it for the week, for that particular week, and then they can sign underneath it for that second week and the date. All right? Okay, your next one, your rotation schedule. So what you will do is check each area where you worked for the day. Chances are, departments nowadays, you're not going to stay in one place the whole day. You might, but chances are you're not. So let's say, for example, you started your day in surgery, and after that particular surgical case was over, you went into the radiology department. And then you did some patients there, and then after you went to lunch, then after lunch, you spent the afternoon in the emergency room. So for that one day, you would check surgery, diagnostic for being in the department, and emergency department. Each day should reflect all of your activities for that day. So you may have multiple boxes checked for that day, or maybe you did some portables before you left. Again, you would have all 4 boxes checked for that date. Okay? And then again, your clinical signature, your clinical instructor's signature there at the bottom. Again, these are due weekly. In fact, I'll finish this one. Your repeat log. Again, all repeated logs you have to have recorded. The date. Now, disregard the medical record number. We had them remove that in this next session. So we do not put a medical record number. The exam, the image that was repeated. Maybe it was the lateral. You clip the costophrenic angles. So you put the reason for repeat. You can just put P for positioning and so on. The initials of the radiologic technologist who is working with you. Remember, it's direct supervision if you have to repeat an exam. So, for that technologist, did the technologist observe you repeating it? Did they assist you with that repeat? Or did the technologist have to come in and perform the repeated exam? That's how that is filled out. These can be filled out electronically too, or we can do what we call a wet signature, either way. Again, you do not need to write in every single exam you do, only the repeated ones. Now, all 3 of those, the repeat log, your rotation schedule, and your timesheet, are weekly and are due on Monday at noon. That reflects the previous week. Now, I understand if maybe you worked on a Saturday or Sunday, again, you need to have them in Monday at noon. If I start seeing a repeat where I have to beg you and, that sort of thing, you're just going to start losing points on your professional evaluation. All right, the next evaluation to go over, this will be due at midterm. So at the end of week 3, you will give this form, hopefully maybe about the beginning of week 3, so your clinical instructor can have time to fill it out. Your clinical instructor needs to fill this out and send it to me directly. They can fax it to me or they can scan it and email, whichever way is easier for them. After they've sent it to me, you will need to make an appointment with me to discuss it. All right, so this is one of our 2 actual telephone conferences you and I will have. So we will discuss it together. This is my chance to come along beside you and coach you, maybe give you some pointers or some things that us old techs can kind of help you out with, or just come along beside you and help you. I will give you the link to make an appointment. It's the You Can Book Me link, but again, I'll be putting that in the announcement page and reminding you of when these are due. Now, same thing for this one. This is, again, your technical professional evaluation. If you look up in the upper corner, the first one said, at midterm or at the end of 3 weeks. This one says at the end, so you know the difference between the two. The form is exactly the same. So what we're looking at is seeing how much you've improved from midpoint until the end. Did we make any improvements? That sort of stuff. So we expect to see things that maybe you need a little bit of coaching with, and that's okay. Again, same as the midterm, you're going to have your clinical instructor send it to me directly, and then you're going to make an appointment to call and discuss. This next one, your clinical education competency record, again, located in the handbook in the appendix, is a 4-page document. All 4 pages have to be uploaded at one time. This is the document that actually gets sent to the American Registry with your application. It needs to be very legible with all the dates in the same month, day, year format. Yes, you do have to have the year. You'll notice the background needs to be white and not gray. Make sure your settings are correct when you upload it into Blackboard. Again, you can select your settings and adjust your settings. It will get sent back to you if there are any errors. The registry will reject the document and delay you taking your test. So you'll have to go through me first. So again, toward the end, or if you want to start filling this out as you go, would probably be the best way. Again, this doesn't get uploaded until the very end. What I would suggest is make an extra copy, and that way you can kind of highlight the ones you still need, and then you have your good copy that you're going to be uploading into Blackboard. All right. On page 3 of that same clinical education competency record, I just want to bring your attention to a couple of things. Under the fluoroscopic studies, you must select either an upper GI or barium enema plus one more fluoroscopic procedure. You are not, let me repeat that, you are not to simulate the upper GI or barium enema. You also have a C-arm procedure that you are not to simulate. It is mandatory, so neither one of those may be simulated. All right. The next part is your portfolio assignment, and I will be going over that in detail in the next video because I don't quite have time to go over that. But anyway, just to reiterate, an upper GI plus one more fluoroscopic exam is required. You may not simulate the upper GI or barium enema. Your C-arm, again, you have 2 different ones. One that requires manipulation to obtain more than one projection, so you're rotating it from maybe AP to lateral. Again, it may not be in the surgical suite per se. You might be performing that in the imaging department. Maybe you're doing an AP and a lateral like a myelogram or an arthrogram. The other one, the C-arm, manipulation around a sterile field. So again, you might be doing a lumbar puncture, or you might be in surgery itself. Neither of these may be simulated. So if any of them come in at your clinical, you want to be right on top of it, because they may not come in that often, especially the upper GI, the gastrointestinal fluoroscopic exams. All right, I am going to go over your portfolio project in a separate video. Again, as always, please let me know if you have any questions. That's what I'm here for, to coach you through the process and make sure you get everything you need. Thanks.